Chin.
All right. Thank you all for coming here today. As we know, Medicaid expansion is a very important issue, and we have some speakers that are going to talk to us about that today. We're going to get right to them because they have to get to work. So first we have State Representative Lisa Ames.
Right. Thank you. And you know, we really have an opportunity right now to provide health care coverage for over 150,000 Iowans. And that's one reason why I support, sponsored, and encourage everyone to promote Medicaid expansion. I've read through the governor's plan and really can't quite understand why we would want to pay more and cover less people. It makes absolutely no sense to me. We have the opportunity to become the healthiest state in Iowa because the governor has talked about that. But when you can promote preventative health care versus sick care, that's the right direction that we need to go. So I am so pleased that we have everyone that is out here today to continue to push the measure forward. As we work through the legislative process, I think my colleagues are starting to hear some of the message. Now, whether they're ready to kind of jump on over quite yet, I can't say they're all quite there yet, but they're definitely hearing from their constituents. And I personally find it quite interesting to have over 60 organizations that support Medicaid expansion, and not one is registered for the governor's plan. I think that's pretty telling. But I think Medicaid expansion covering 150,000 Iowans is the right direction to go. Thank
you. Next we'll hear from Dr. Sheldon Spencer, a physician here in Ames.
Hi, good morning. And I am very happy to be here, and I'm very grateful for all of you to be here. I think you're always looking for some way to move public policy forward. You can make your phone call, you can send your letter, but I'm very grateful to Sue to organize this. Maybe this will give a little push somehow or another to let the governor know that there are people that want to see Medicaid expanded. I come at this getting ready to go to Marshalltown, and by the time I get there I'll be fully caffeinated, and I'll be seeing all kinds of people, difficult people, simple cases. I'll see Medicare patients, Medicaid patients, Blue Cross, Blue Shield, United Healthcare, but very rarely will I see a private pay patient. Even though office is $50 to $100 to see me, private pay patients will, in general, get sicker and sicker and wind up in the emergency room for $1,000, and if really sick in the ICU for $10,000 a day. Penny-wise, pound foolish. So I wanted to make 2 points, which will be absolutely shocking, will cause your jaws to drop. One is that people don't like to go see the doctor. I know it's hard to believe, but if you add the incentive that you have to pay, you don't have the money to pay, then you won't go see the doctor, and guess what? You get sicker. I'll give you a little example. Maybe a year ago at the free clinic, I saw a 45-year-old woman who worked at a convenience store, and worked part-time, had no insurance. She fell, hurt her shoulder. Shoulder got worse. Now you all get a cold or a headache, say, I'm not going to go see the doctor. I'm sure not going to go see the doctor if I have to pay. And unfortunately, her shoulder got worse and worse. 6 weeks later, she's in the free clinic because she can't afford anything else. And her shoulder is frozen. I don't know whether you know what that means, but it means she can't move her shoulder. This is not good. This is horrible because she will lose function in that shoulder and she won't be able to work. Again, an example where delaying care and service is counterproductive. Finally, the second big point I want to make, which I know will shock you as well, is that if you don't have insurance, you do worse than if you do have insurance. This has been shown over and over and over. The most recent example is Oregon, where they had a lottery system for health care, and those who won the lottery and had Medicaid coverage had good health care outcomes. Those that didn't win the lottery, did not have health care, did not have Medicaid, had worse outcomes. So, the evidence is very abundantly clear. It is the right moral thing to do. It is the right practical thing to do, and I lament that our leader, particularly Governor Branstad, cannot bring himself to get there to that point. It ain't perfect. You know, and Ann will talk about the failures of Medicaid, and I've seen that, and it's not a great system either. But I think as Europe has demonstrated, Australia, New Zealand, Canada, Japan, and much to my chagrin, Mexico, Ghana, and Vietnam, providing universal health care for all your citizens is a good outcome. Having a healthy population is a good outcome. And the best we and I can do is to be here and to support the efforts of our politicians that are promoting this type of health care policy. And I thank you, Sue, for organizing, and I'll be there with you every time you get something going.
All right.
All right?
Thank
I'll
you.
help you. Thank
Okay.
you.
Our final speaker is Ann Kinzel, who is a healthcare expert in her own right, who's been fighting the good fight for years and years. So, Ann, take the lead.
Thank you. Well, good morning, everybody. So, you guys are pretty special. You got out here on a gray, disgusting, rainy day to tell your fellow citizens how important it is that Medicaid be expanded in the state of Iowa. And let's not even stop at the state of Iowa. In the richest country on earth, bar none, that we should have to be out here at 9 o'clock on a gray morning asking that our fellow citizens get help for their medical care. It's pretty sad.
That's right.
That being said, I'm really happy that you're here. I started in this healthcare game in 1988 as a very young attorney assigned to one of the busiest and saddest hospitals in California, a now defunct facility called Valley Medical Center. 60% of our patients were county indigents. Okay, they weren't even able to get Medicaid. 30% were on Medi-Cal, what California calls Medicaid, and the rest were private pay. There was no doubt, even as green as I was, that those folks on Medi-Cal, Medicaid, were far better treated and had far better outcomes than those folks on Medicaid. Never did I imagine that it would take us this long to get an Affordable Health Care Act. Never did I imagine that we would be begging our governor in my new home state to extend health care coverage to the poorest, the weakest, and the least able among us. Dr. Spencer said chagrin, I say embarrassing.
That's right.
Okay? It is embarrassing to live in a country like this and have to come out and say, Governor, please expand Medicaid for folks. They really need it. Okay? If he doesn't get that, I don't know what he looks at when he gazes out of Terrace Hill every morning, but he's not seeing a whole lot, okay? So Medicaid, sure, Medicaid is imperfect. There are times, as I told Sue earlier, you know, I'm disappointed as a progressive that I have to come out and advocate for a program that in many ways has passed its due date. It's true, okay? Medicaid is imperfect. Governor Branstad is correct on that point. But the imperfections of Medicaid are not solved by some half-baked, half-loafed, Iowa doesn't really care program, okay? That's not the way to make Medicaid better. The way to make Medicaid better is to fund it, to look at what we do well, to look at what we do poorly, learn from those things, and start doing a lot of things better. I want to be out here advocating next time for something better than Medicaid.
That's right.
Yes.
Okay? But first we have to have it. So here you are. When I was studying health insurance in Iowa, there's always about somewhere around 330,000, 360,000 Iowans that are uninsured. This number never really changes a whole lot. It's true that in Medicaid, a lot of people that are helped are elderly. Okay? Medicaid backfills a lot of things in our society where people are not able to save for their old age. But it also helps working people, it helps kids, it helps people who have catastrophic accidents and all their other resources are wiped out. So in other words, it can help any one of us at any time. And I like knowing that if things really go bad for me, for people I love, that we have something in the back pocket in reserve for them. For others who work hard their whole lives and our society doesn't provide them benefits, I'm glad that Medicaid is there to help them. So all in all, I could spend hours talking about the technical sides of Medicaid, but who would want to listen to that on a grade A in Ames? Really, what's important is the emotional side of Medicaid. Medicaid, imperfect as it is needed for Iowa citizens. It's the right thing to do, and Governor Branstad needs to quit being so damn stubborn and just do it.
That's right.
I have to go to work too.
So, I don't know, about 6 weeks ago, we were at an event and listening to some people talking about Medicaid expansion and the governor's plan, and we were told that what we need to do is get the information out into the community. And Matt Sanovic and I were sitting across the table from each other, and we kind of did a little, we can do this. And so we met and together formed the Healthiest Iowa initiative as our response to the governor's Healthiest State initiative. We're not really sure what state the governor's talking about. I mean, it's certainly not Iowa. It might be Arizona or Ohio or one of the other red states that have gone ahead and expanded Medicaid for their people. What we don't understand is how the governor can say no, continually say no to our most vulnerable population. It is unthinkable to me. It makes me sick, and I have insurance. Today in Ames, they are holding the Governor's Conference on Public Health. And where's the governor? Hopefully he'll come. Hopefully he'll be here and hear from some of the people here and start to come around and change his mind. You know, he works awfully hard to keep wrestling in the Olympics, which is a good thing. I mean, that's fine. My son wrestled and coaches wrestled. Why isn't he working so hard for everyday citizens who need and deserve health care? I heard him say on the news last night that he thought the nominees for the Board of Regents were treated shabbily. Well, maybe they were. What about the 150,000
That's
people
right.
that he is treating shabbily every day,
That's
that he denies them the coverage to the health care they need and deserve?
Yes.
You know, Terry Care, this ain't gonna cut it. We have Medicaid. Medicaid will work. As we've all heard, it's not perfect, but Terry Care is certainly not the way to go. So what we need to do is continue to fight, continue to tell the governor that we've got to expand Medicaid in Iowa. Thank you all very much.
Thank you.
Anyone else have anything they'd like to add? We'll be up on, YouTube?
Yeah, we got YouTube. I also just want to make sure to remind everyone, we've got, if you go to healthiestiowa.com, if you haven't signed up already, please do. There will likely be, we expect there'll be a public hearing about this in the House, or at least that's what we've been told, so where anyone can come and speak for 3 to 5 minutes. So as soon as we know when that happens, they usually give 24, 48 hours notice, so it's not, it's not quick notice, but as soon as we know when that's going to happen, we'll blast out the information.
Right.
And let everyone hopefully have their voices heard if you want to come and talk about it. So, and we'll also be doing a delivery of all the petition signers. We've got over 1,400 now, so we'll be delivering those to the governor at some point. So we'll help everyone out with that as well.
Great.
Yeah.
Cool. Thank you both for leading this. This is great. So
We just got to keep it up.
I know.
Just got to keep it
That's
up
right.
till they do the right thing.
That's right.
All right.
fantastic.
And now let's go get more.